Take a look at these beauties. These beauties were done many years ago. This patient traumatized his teeth when he was 10 years old. I guess he's someone threw a rock at him and he hit his front teeth, lower anterior teeth, got root canals. Take a look here. Look at these root canals. Look at this post. This post is almost perforating to the outside. All right. And these posts, they're not even doing anything. You see them? They're just there, but they're not doing anything. So this post is pretty much perforating to the outside. The dentist didn't even follow the path of the canal. And on top of that, broke a file here. I think this is okay. I think this is all right. There is recurrent decay here. I think this is okay. I just told the patient, monitor the tooth, have your dentist monitor it for now. He's gonna have all of this cleaned up, of course. As far as tooth number 24 and 25 go, you can see a periapical lucency here. You can see a periapical lucency here. Very likely there's a missed canal here, tooth number 25. In this angulation, you can see that very likely there's a missed canal here. So you can see the gutta-percha is not centered here. There is less dentin here versus here. So very likely the dentist missed a canal here. All right. And these are the teeth, and take a look here. There's a sinus tract right there as well. Okay. So that's 23, 24, 25. Sinus tract right there. So again, no need for me to redo the root canal on tooth number 23 right now. So we'll visit that tooth maybe later if we see any problems like these lucencies on tooth number 23. But right now it looks like it's clean. Next time we're gonna focus on redoing the root canals on tooth number 24 and 25. And as I said, I really think there's a missed canal here. All right, so that's this case. Okay, now check out this case. This patient was referred to me for endodontic retreatment of tooth number 30, and patient says the root canal was done about 20 years ago, and tooth started to hurt a few weeks ago when he would bite down on it, try to chew on it. All right, so you can see there's a crown here, previous root canal. Look at that right there, that lucency, furcation lucency right here. No periapical lucencies. It's all clean. No periapical lucencies. There's definitely something here, of course. Percussion tender, palpation tender. Let me show you clinical presentation of the tooth. You can see there's a buccal parielis right there associated with the tooth as well. Let's go ahead and probe it. All right, yeah. We'll start from here is 2 millimeters, and then it just drops here. That's 1, and then as you continue going, walking the probe, now it's about 8 or 9 millimeters right there. Okay. So as you saw, based on the probings and everything, I'm not optimistic about this tooth. This tooth overall has a poor prognosis. Very likely there could be a vertical root fracture right there. Okay. So I told the patient, I don't think you should spend a penny, a dime on this tooth, trying to save it. I think the best thing to do would be just take it out, bone graft, and put a dental implant there, and you're good to go for many years, versus spending tons of money on this tooth trying to see if it could be saved, only probably in a few weeks or months or a couple of years maybe, and then up having to have it pulled, and then you would regret spending all that money on it. So right now I think cutting your losses and just taking this tooth out and putting a dental implant would be the best option. He agreed. He's going to have it pulled and put a dental implant in there.